Let us discuss about Bell's palsy. Bell's palsy. What is this Bell's palsy? Bell's palsy is the paralysis of facial nerve. We can say peripheral facial paralysis. Peripheral facial paralysis, and this paralysis is of idiopathic type. That means we don't know the cause, and this is acute onset. It has got acute onset. If you put this in a definition form, Bell's palsy is defined as peripheral facial paralysis, or Bell's palsy is a idiopathic peripheral facial paralysis which is of acute onset. Clear? So this is the definition of Bell's palsy. As I told you, it is of idiopathic type. We don't know the cause. Okay, that is to remember. What could be the reasons? Most of the time, the Bell's palsy is caused by viral causes. What are the important viral causes? Herpes zoster, herpes zoster, herpes simplex, herpes simplex, herpes simplex, and Epstein-Barr virus. Epstein-Barr virus. So these are the important viral causes. And next cause is vascular causes. What happens in vascular causes? In vascular causes, there is hypoxia of blood vessels. There is hypoxia. When there is hypoxia, it results in vasodilation of blood capillaries. Right? When there is vasodilation, there is increased escape of fluid. Right? Escape of fluid, and this fluid compresses facial nerve, and that results in paralysis. Clear? So this is vascular cause. What happens in vascular causes? There is fluid leakage due to hypoxia that compresses facial nerve. That results in paralysis. Clear? So this is vascular causes. Then hereditary. Most of the time, it can be due to hereditary. There is hereditary predisposition. Then autoimmune disorder. Even there are instances where autoimmune disorders have been seen. Okay. So what are the causes of Bell's palsy? The first one is viral causes. The second one is vascular ischemia. Third one is hereditary. Fourth one is autoimmune. Right? These are the four important causes. Now let's see what are the clinical features that we can see in Bell's palsy. Suppose this is face. Okay, this is face. These are eyes. This is face. Clear? So this is forehead. Clear? So this is the side. This is the side of facial paralysis. Let's see the symptoms, signs and symptoms. So here we can see loss of wrinkles on forehead. Clear? Here in the eyes, what we can see is widening of palpebral fissure. Right? And we can also see what lacrimation of eyes. This is called epiphora. Next, there is absence of nasolabial fluid. Absence of nasolabial fluid. At the angle of mouth, we can see drooping of angle of mouth. So these are the important important signs. What are the signs? Loss of wrinkles and forehead, widening of palpebral fissure, epiphora, absence of nasolabial fluid, drooping of angle of mouth. These are the signs. Then what are the symptoms that you can see? In the ear, you can see pain. Why there is pain? The reason for this pain is loss of stapedial reflex. Stapedial reflex. What happens when there is loss of stapedial reflex? You see, this stapedial muscle is innervated by facial nerve. Facial nerve. What this stapedial muscle does is it protects from loud noises. Protects from loud noises. So when there is loss of innervation, this stapedial muscle will undergo paralysis, and that results in loss of this protection. Due to this, there is pain. Clear? There is pain. Okay. And if take in the eye, the patient is unable to close his eyes. In the eye, he is unable to close his eyes. If he closes eyes, what happens is the eyeball, this eyeball will turn up and outside. When you close eyeballs, what happens is eyeball turns up and outward, and this is called Bell's phenomena. Bell's phenomena. Clear? And if you see if you look at angle of mouth, at the angle of mouth you will see drooping of or dripping of saliva. Dripping of saliva. Dripping of saliva. Clear? So these are the important signs and symptoms. So let's see the symptoms once again. In the eyes, what you see is Bell's phenomena. In the ear, you will see pain. At the angle of mouth, you will see salivation, or you can say dribbling of saliva. Okay, these are the signs and symptoms. Now let's see the treatment. Treatment. What is the treatment? See, that first we have to assure the patient. We have to give assurance. Then, as there is pain in the ear, you have to give analgesics. Analgesics. And as he is unable to close his eyes, you have to protect eyes, right? Because cornea will get damaged if you don't protect eyes. Okay, and we have to give physiotherapy. Physiotherapy. This is general treatment. Then we'll give medical treatment. What is the medical treatment? In the medical treatment, we use steroids. We use steroids. What are the steroids that are? What is that steroid that can be used here in Bell's palsy? The steroid is prednisolone. Prednisolone. Here, how do we give this prednisolone? We give prednisolone when patient comes within 1 week. If he comes within 1 week, then we'll give prednisolone in the dose of 1 milligram per kg for 5 days. After 5 days, we'll again see the patient. If there is improvement, then we'll taper the dose in next 5 days. In the next 5 days, we'll taper the dose. If there is no improvement, if we don't see improvement, then what we do is we'll continue the same dose for 10 days. If there is improvement after 10 days, then we'll taper the dose in the next 5 days. Okay, this is how we give steroid therapy. Okay. Then what are the other drugs that we can use? We can use vasodilators. We can give vasodilators. We can give vitamins. We can give vitamins. We can give mast cell stabilizers. Mast cell stabilizers. These are the we can also give antihistamines. These are the other drugs that we can give. Let's revise the treatment once again. In the treatment, what we do is we will give general treatment and medical treatment, right? We can also give surgical treatment also. In surgical treatment, what we do, we decompress the nerve, right? So in the general, what we give, first one is reassurance. Second one, we'll give painkillers, right? Then we'll take care of eye, right? Then will physiotherapy. In the medical, we'll give prednisolone. Prednisolone. In the surgical, we decompress the nerve. This is an important one that you have to know. Clear? And I forgot to tell you about diagnosis, right? I'm sorry for that. Let's see how we diagnose the case. So diagnosis mainly from the history, and here this Bell's palsy is always diagnosed by diagnosis of exclusion. We have to exclude other classes, then we'll come to this diagnosis. Okay, diagnosis of exclusion. Then we'll do nerve conduction studies. Nerve conduction studies. We'll see symptoms and signs. Symptoms and signs. We'll take X-ray studies. We'll do blood examination. We'll do total leukocyte count, and we'll also do sedimentation rate, blood sugar, serology. All these things we'll do, and we'll also do topographic test. Topographic test. And let's understand what are these topographic tests. See, if you see the course of, if you see the branch of facial nerve, suppose this is facial nerve. First, there comes the branch to lacrimation. Okay, branch to eyes for lacrimation, right? Then there comes nerve to stapedius. Nerve to stapedius. Then there comes nerve to lingual, sublingual and submandibular gland. That is coda tympani. Coda tympani. Okay. Then there comes motor fibers to face. Right. So here we'll do test for all these functions. For lacrimation, we'll do Stimmer's test. For stapedial reflex, what we do is we'll check for stapedial reflex. Stapedial reflex. For coda tympani, we'll check for submandibular salivary flow test. Submandibular what we do? Submandibular. That means we measure salivary secretion. Submandibular salivary flow test. Then we'll also check for taste. Okay. Last test is we'll check for taste. Okay. So these are the important tests. These are the topographic tests. What are the topographic tests? Simmer test, stapedial reflex test. Then third one is submandibular salivary flow test. Fourth one is we'll check for taste test, right? So these four tests are called topographic tests. Okay. So this is something about Bell's palsy. Thank you for watching.